My hands kept shaking and I just couldn't control it.
My daughter's teacher called. Scariest day of my life. My muscles ached all over.
I've been having such terrible headaches. I can't even function.
I'm terrified of my upcoming procedure.
Are you struggling like these people were? If so, you may be in need of a neurologic or neuromuscular drug. These drugs can be used to treat Parkinson's, seizures, migraines, muscular sclerosis, and are even used for sedation and surgical procedures. Let me show you how our nurses, doctors, and pharmacists work together to treat your symptoms in the safest and most cost-effective way so we can get you back to your life.
Hey guys, you got a second to go over some of these medications with me?
Yeah, sure. I've been meaning to ask you, what's gabapentin?
Oh, baclofen? It's a skeletal muscle relaxant that inhibits synaptic responses in the central nervous system and decreases the severity of muscle pain.
Oh, so what do I need to teach my patient?
Like not to take with alcohol or other sedatives, not to take if pregnant or breastfeeding, not to operate heavy machinery, encourage slow movement while getting up, to avoid postural hypotension.
Oh, okay.
Oh, hey, I just filled that phenytoin script for you.
Dilantin, is that for the little girl?
Yeah, it's an anticonvulsant. It slows down impulses in the brain that cause seizures. Make sure that her mom reports any worsening symptoms like mood, agitation, irritability, and thoughts of suicide.
She needs to see a dentist regularly and make sure that she knows stopping abruptly could lead to increased seizure activity. Did you educate the mother on potential side effects?
Yes, I did. Twitching eye movement, tremor, slurred speech, muscle stiffness. Did I get it all?
Yeah.
Hey, do you think we finally got the right dose on the anti-Parkinson's drug?
Yeah, I think we finally got the right dose on the Cinnamon. It's tricky to determine the right amount because the med is affecting the amount of dopamine that's available to your brain, which lessens the symptoms of Parkinson's, and too much can cause some nasty side effects.
Yeah, that drug does have some pretty bad side effects, like blurred vision, insomnia, hallucinations, dyskinesia, and orthostatic hypotension. So you want to keep the dose as low as possible while effectively treating the symptoms.
Hey, remind me to put in that script for that Imatrax and to also put one in for myself. I might need that anti-migraine drug after today.
Write it down now so I can get it to you, and you can get that first dose in, because if it doesn't work, you can take another dose in 2 hours. The way it works is it narrows the arteries to your brain so that it constricts the blood and stops pain signals from being sent to the brain.
You know what? Sumatriptan never really worked for me. I had such bad side effects. I always got dizzy and weak, and my chest really hurt. But it seems to work really well for most of our patients.
Did you make sure to educate her to use it no more than 3 to 4 times a month and to use contraception? Oh, and hey, she's not taking any SSRIs, right?
Yeah, that would be bad.
No, that would be really bad. Could cause serotonin syndrome.
Bad news.
I have a patient being put under general anesthesia. Do you have any recommendations for a cheapest, safest drug?
Well, I would say rocuronium. It's a neuromuscular blocking drug that's used to relax the muscles by blocking the signals between your nerves and your muscles. It's also called Zimmeron. It's worth the $229 for 10 milligrams per milliliter, and it's the safest for intubation.
Since this is an IV med, sedation happens quick, so we're going to have to be ready to intubate within 1 to 2 minutes.
That's you.
And to watch for that transient hypotension or hypertension.
Okay. So what is the dose at again?
It's like 0.6 to 1.2 milligrams per kilogram, somewhere in there. I'll write it up for you.
Well, let's get back to our patient.
We don't get paid to take the break.
The doctor told me I had Parkinson's and prescribed me Cinnamon 25-100 3 times a day. For a little over $1 a pill, I no longer have the tremors in my hand.
She had a seizure, so the doctor started her on 125 milligrams of Dilantin 2 times daily. She has been seizure-free ever since. $125 a month is a small price to pay to have my daughter's childhood back.
My doctor diagnosed me with muscular sclerosis and prescribed me 20 milligrams of baclofen 3 times a day. It only cost me $20 to $22 a month, and I no longer have any pain.
The doctor prescribed me 50 milligrams of Imitrex to take when I feel a migraine coming on. Thank goodness my insurance covers it because I couldn't afford $30 a pill.
My doctor will be using rocuronium to aid in the intubation of my surgery. I feel ready for my procedure, knowing how safe and effective it is.
Previously on Grey's Anatomy.